Welcome to Genomics Now, a podcast series where you can learn how genomics is developing in England's NHS. This podcast series is recorded in 2024 and is part of the North Thames Genomic Medicine Services Educational Toolkit. In each bite-sized episode, we explore what is changing in genomics. We answer the questions on genomics we've been asked by the different healthcare professionals. We talk about the ways genomics may impact different healthcare roles, and how genomics can be used to successfully improve patient care. Hello, I am Dr. Shazia Mahamdallie, and I'm part of the North Thames Genomic Medicine Services Workforce Education and Training team. In today's final episode of this pharmacogenomic series, Dharmisha Chauhan joins me again. Dharmisha is the lead pharmacist in the North Thames Genomic Medicine Service Alliance. Hi, Dharmisha.
Hello again.
Dharmisha, thanks for returning for this final episode. Why and what are we going to talk about today?
So for this episode, we will focus on the importance of pre- and post-pharmacogenetic counselling and its importance to shared decision-making when we are personalising our patient's treatment plan.
Great. So just to remind our listeners, if there are any genomic terms and concepts that we don't explain in today's conversation, please do listen back over the series, especially episode 2, as we've given a lot of information that's really helpful along the way in the series about those terms and concepts. So, Dharmisha, to kick things off, can you share how pharmacogenetics is reshaping the way we think about medications?
Yeah, so we have known for a long time that we can use pharmacogenetics to identify which patients are likely to benefit from treatment with minimal side effects, and also use pharmacogenetics to prevent really severe adverse drug reactions, which can lead to hospitalization. Currently, we are using pharmacogenetics in more specialised settings such as cancer, cystic fibrosis and neonatal care. But there is a vision within NHS care to expand the benefits of pharmacogenetic testing to drugs which are more commonly prescribed, such as clopidogrel, proton pump inhibitors, statins and antidepressants. As the scope widens, clinicians, especially pharmacy teams, are widely anticipated to play a role in the safe implementation of pharmacogenetic testing and be expected to counsel and provide patient information.
So just building on that last point about counselling and patient conversations and providing information. So when it does come to counselling or talking to patients before and after pharmacogenetic testing, what are the key points pharmacists and prescribers should cover?
So in terms of the key points, I like to split out the counselling requirements in the form of pre-pharmacogenetic testing counselling and post-pharmacogenetic testing counselling. So for the pre-counselling, as a starting point, I would try to cover the benefits and purposes of testing and the basic genetic elements of pharmacogenetic testing to introduce terms of gene changes, which can affect how medicines will be metabolized within a person's body, but without using scientific jargon, which means I would really need to know my genomic definitions well. So, for example, instead of saying allele, I would use the word gene change. But it would really depend on the person or patient I have in front of me, because it's also possible to have a patient who has more genomic knowledge than another person. I would also like to explain both the benefits and limitations of testing. So, for example, if I had someone of a different ethnic background where the panel doesn't include particular variants being tested, just to explain what those limitations are. And for some drugs, it may also be better to directly measure drug levels compared to a pharmacogenetic test. So it's really having that conversation with that patient on why we're testing, what we're trying to do. We also need to make sure that we are giving the patient enough time to raise their own concerns and ideas, including their expectations of testing, and to reassure the patient as well. So how will the information that we obtain be shared? How would it be stored? Because you really want to make sure that the patient is entrusting you to look after their data safely. For the post-test counselling element, it would really be important, I think, to show the patient their pharmacogenetic report and to go through it with them and really explain what the results mean and how it will affect their medication. It's also important to provide the patient the time to explain back their results, to ensure that they understand what has been said and to enable them to ask questions as well. So it really means giving that patient that empowerment to ask more about their medications. And also, if the patient's in more than one medication, what would that mean in terms of drug interactions and how will that affect the dose? So there will be an element of critical thinking that is required. So really, it requires shared decision making before you make changes to a prescription. And when you've made the changes, you'll really need to make sure you've got that follow-up appointment in place as well. I also think it's really important to give the patient their pharmacogenetic report to enable patient empowerment. And also, they'll be interested and they may want to know what it means for their family members too. And I think that's a natural process of having a pharmacogenetic test done.
Yes, just at the end there, so thank you for those tips. But just at the end there, you mentioned about shared decision making and how it's important in healthcare. How can prescribers really make sure when they've got a patient in front of them, you're talking about something that's very unfamiliar, that they are involving patients in that shared decision-making process during pharmacogenetic counselling sessions?
Yeah, so within shared decision-making, it really requires understanding the patient's perspective, which includes their own ideas, concerns, and expectations, to not only pharmacogenetic testing, but how it can affect their treatment plan. They may be on more than one medication. So what does that mean in terms of the treatment plan as a whole and for their journey throughout the healthcare system? So you're working with the patient with the emphasis of using pharmacogenetic testing for safer prescribing. And in some cases, that shared decision-making process may be easier. An example of this is if a patient had a pharmacogenetic test done to prevent severe side effects, such as DPYD testing for fluoropyrimidines. If a patient has a variant identified, the conversation will center on prevention of severe side effects, prevent hospitalization, and in some cases, severe cases of death, depending on the variant that has been identified. So the action and decision-making process, if a DPYD variant is identified, will involve a dose reduction or prescribe an alternative drug. So actions that will not have significant negative impact on an overall patient outcome, and that will be done with the patient. In other cases, the decision-making process can be very complex. So, for example, if you had a mitochondrial variant, the M1555 variant, for example, increases the risk of bilateral hearing loss after a single dose of an aminoglycoside at normal therapeutic levels. So if a patient has severe life-threatening infection and the aminoglycoside was the best treatment based on antimicrobial sensitivity results, and they were positive for the variant, then you might have a different conversation. So if the patient needed that antibiotic, what would you do if the patient was a child, for example? And would that decision-making process and outcome be different if the patient was an adult, say if they were over the age of 65? How would you address that? So therefore, there will be an element of critical thinking because the clinician will still need to consider the patient's, what I consider ideas, concerns, and expectations alongside the factors that we always consider when we're prescribing a drug, such as renal impairment, liver impairment, blood results, drug and food interactions, and what the outcome is in terms of the prescription, what it means for their patient outcomes in the long term as well. So when developing a treatment plan with a patient, it's really important to state that pharmacogenetic testing is another tool that we are using alongside everything else we do to ensure safe and effective prescribing. So it's not there to replace another tool. We're using it as an add-on to look at the patient as a whole.
Thank you. So I can see how that's critical thinking, understanding the context and the patient in front of you, and that shared decision making is important. But then, of course, to be able to do shared decision making, one needs to be able to communicate medical information, which can be generally tricky, and especially in this circumstance, for example, in genomics, where it can be complex and it can be very unfamiliar. So drawing on your experience, what are some of the effective ways prescribers can explain pharmacogenetic information to patients who might not be familiar with it or may speak different languages, for example?
Yeah, necessarily important because, as we know, English may not be everyone's first language. And also some genomic terminologies may be different to interpret on a piece of paper. So, for example, how do we translate the word pharmacogenetics if the term itself does not exist in the language our patient speaks? So I feel there really needs to be a more creative way to share information. I feel that videos are a useful method, especially if you can use illustrations or show a video of a patient having a pharmacogenetic test done. And you need to also make sure that you're using illustrations or videos where the patient can identify with that person on the video so that they look like themselves, for example, and they can see themselves having that test done. So I think that's really important. So we really need to be creative and use different channels. For example, there's a lot of work that's being done through community centres or places of religious places where people go as part of their community, where you can share that information in a more different way that helps empowerment, not just a simple patient information leaflet on a piece of paper.
There's a lot to learn for people like us, communicators, for clinicians, for example, and educationists. So we've got to the point of the information is there. We conveyed the information in a way that is digestible and understandable. But obviously, there might be times and situations when actually the patient's test result doesn't provide the information that you expect or they expect. So how should a pharmacist or a prescriber handle those situations when the findings are inconclusive or don't explain a patient's side effects?
Yeah, I really do think that patients will be intrigued to know what their pharmacogenetic results might be. And it may also help people feel less anxious about taking their medications. And it may even improve patient compliance or adherence to medications. But it goes back to that point that we need to be mindful that some patients may be disappointed if no variants are found. That could explain their side effects or their lack of response to treatment. And this is why I think that the pre-test counselling is an important element to explain the limitations of testing, so you set that groundwork. So, for example, our testing panel is limited and may not cover all the variants related to a person's ancestry, or that some drugs may have very complex biological pathways after administration, which really cannot be explained by pharmacogenetic testing alone. So it's really ensuring that we have that conversation at the pre-test counselling level so we don't disappoint patients when we have those inconclusive results, and really think about the drug that we're testing, which some can be quite complex at a metabolic biological level.
Thank you, Dharmisha. I've really enjoyed this episode where we've talked about kind of communicating, not just understanding, but communicating genomics. So it's time to wrap up this series. As you know, we like to end our episode on what's next for genomics in this space. So for the final time, no specific question from me this time, but instead, is there anything on pharmacogenetics horizon that you would like to tell us about that we haven't already touched on?
I think we'll hear more about the benefits of point-of-care testing in different clinical settings. So this is where a pharmacogenetic test can be done quickly at the patient's bedside. There is so much new technology and startup companies out there that are coming through. So this is a really interesting field to keep an eye on. I also think that healthcare commissioners really do understand the value of offering wider and larger pharmacogenetic panel testing on the NHS. But the real question is how? How do we do this? And how can this be implemented across, large populations level across England or the UK? So I think that once this implementation element has been designed and nailed down, hopefully we'll see this in the future for the NHS, and it will really be a world first if we can achieve it.
Oh, brilliant. So thank you, Dharmisha. I've really enjoyed our conversations, as I said, on pharmacogenetics, and I've learned a lot about this area that I didn't know about, and how it's applicable to the clinical role of the prescriber, so not just the pharmacist, but anyone that's prescribing, and the emergence of precision medicine.
Yeah, thank you. It has been so much fun to do these podcasts and share how pharmacogenetics can help us prescribe more effectively and safely too.
Thank you for listening to this episode of Genomics Now, a series of conversations hosted by healthcare professionals. The North Thames Genomic Medicine Service aims to complement other genomic-focused educational tools with these bite-sized podcasts. So do visit our website for more resources and updates on genomic-based clinical developments and research. If you've enjoyed this episode, don't forget to share your thoughts and spread the word by tagging the North Thames Genomic Medicine Service on social media.